Assalamu alaikum everyone, welcome to The Health Show. It's Tuesday, it's 7 p.m. and I am live from British Muslim TV studios here in Wakefield. My name is Sulthana Ahmed, I am your GP, I'm your host and your GP for today. So on today's Health Show we have two very interesting topics to discuss. In the first half we will be discussing pregnancy and being pregnant during the pandemic. Now, you may be aware, as natural and as beautiful pregnancy is, it is associated with lots of changes in the body. Now, one of those changes involves the immune system. Many of you will know that the immune system is in charge of fighting infections, fighting bugs, keeping you healthy, and this has been brought to everyone's attention during the pandemic. Now, whilst everyone has gone through their unique struggles during the pandemic, obviously pregnant women also have struggled with new fears, new anxieties about being pregnant, risk to themselves, risk to their babies, risks involved in attending hospital appointments, not attending hospital appointments. So it's been quite a confusing time that hopefully this show will help you navigate. Now, with me today to discuss the topic in more detail is a lovely midwife called Amina Hatia. She's a midwife down in London, and together we will go through what you should expect, what you should be aware of as a pregnant woman during this time. So if we can have the guest on, that would be great. Amina, can you hear me?
I can hear you. Assalamu alaikum. How are you?
Walaikum salam. I'm good, thank you. Thank you so much for joining us this evening and welcome to the show. If you would tell our viewers who you are and what you do.
Okay, yep, sure. So as you said, my name's Amina. I'm a midwife and I work in London. I work partially for a charity called Tommy's, which does research into pregnancy health and pregnancy loss. And I also work as a midwife in a big London teaching hospital. So that's kind of the bare bones of who I am and what I do, really.
Thank you so much. Okay, so we are going to dive right into questions today because we do have quite a lot of them. Now, many people will be aware that the NHS has been under immense pressure this year trying to manage implications from COVID-19 and trying to run their existing services. Are you able to discuss any impact it has had on your particular service?
Yeah, sure. So, you know, as you've highlighted, COVID-19 has affected everyone within the NHS and all NHS services. You know, we're playing catch up for a little while with sort of everything that was happening. And maternity, like all other kind of essential services, was affected by that as well. Maternity is quite unique in the sense that we're in a lovely little bubble and we're usually, you know, kind of protected from kind of other kind of factors that affect the rest of the hospital in that way. But when we went into lockdown, of course, there was the kind of concern about people, are they able to attend appointments? Should they be attending appointments? There was a lot of uncertainty, I think, to begin with.
Yeah.
And the kind of 3 royal colleges which deal with kind of maternity issues in the UK, that's the Royal College of Obstetricians and Gynecologists, the Royal College of Midwives, and the Royal College of Child and Paediatric Health, came up with kind of very clear structures and plans, essentially to kind of ensure that people still keep accessing that service. And we have done that despite the difficulties in, you know, sort of people being worried about coming into hospital. All maternity services have continued functioning. We're an essential service. Maternity care is essential. We were quite lucky in the sense that we were kind of ring-fenced, that we weren't losing our staff being deployed into other areas. So for pregnant women, whether you were having your baby in March 2020 or you're having your baby in March 2021, midwives, obstetricians, doctors, the entire service was still very much up and running, albeit differently. We looked different. We had our PPE on. We were kind of, you know, we had been social distancing, etc. So little changes there, but still very much up and running and functioning to keep women and their babies safe.
So that's very reassuring to know. So one of the concerns that most of my pregnant patients have is they are aware that pregnant women have been placed on a list, you know, where they may be vulnerable, they have to be cautious, they have to be careful, and they are aware that whilst they are pregnant, their immune system may not be able to handle flus, viruses, like it would usually when they were not pregnant. And so they have a fear about what's going to happen if they catch COVID. So would you say it's safe for pregnant women to attend their hospital appointments?
Yes, absolutely. You're only being asked to come in to attend appointments if it's necessary for you to do so. We're very, very conscious of the fact that, you know, it's a stressful time. It's stressful being pregnant. Being pregnant in a pandemic is incredibly stressful, and then kind of being worried about your health kind of adds an extra layer to that. So appointments, where possible, if it was suitable, were made into telephone appointments. But like I say, pregnancy requires that kind of face-to-face connection. We need to do kind of physical checks on you quite regularly to keep yourself and your baby safe. And in those circumstances, if you're asked to come into hospital, if you're being asked to attend hospitals, appointments in hospitals or in clinics, definitely safe. As I said earlier, we have all been kind of practicing social distancing. We have our PPE on. We're making sure that people aren't waiting too long in kind of waiting rooms. Anybody who's had babies before will kind of, before the pandemic, will remember that, maternity waiting rooms are filled with people. And that's very, very different now, spaced out and apart as healthcare staff, where we're all kind of being tested regularly. And that's so that people feel safe coming in, because that kind of routine antenatal care is really, really important. That's what keeps mothers and babies safe.
Now, there are specific groups of women who are at higher risk of potential hospitalisation due to COVID. And there was a study which was published earlier this year which said women who are Black, South Asian, they are over 35, have a BMI of 25 or more. They may have pre-existing conditions like diabetes, high blood pressure. The advice is no different for them, is it? It is still the hospital appointments are safe and we have adapted everything to look after you safely.
Absolutely. And for women who kind of fall into those risk groups of, as you said, Black, Asian, minority, ethnic, or have underlying health conditions, or women who are kind of, kind of towards the end of their pregnancy, it's even more important that they keep attending those appointments. In fact, the kind of advice that has come out again from the Royal Colleges is that women from a Black, Asian, minority, ethnic background are having additional appointments because we're aware of this kind of increased risk factor. So at least a minimum of 2 extra appointments, kind of face-to-face appointments, to ensure that they are kind of accessing care where possible. All kind of women from the kind of not necessarily high risk, but from backgrounds where, we are being extra cautious, are being advised that, get help sooner rather than later. Don't kind of think, oh, I'm going to kind of put pressure on the service, or, I'll just kind of ride this out and see how it's going. That it's really kind of important that if you're feeling unwell, if you're concerned about your health, getting help sooner rather than later. And that information is kind of being fed back to women when they're booking, when they're having their antenatal care, when they're having those appointments. So as you kind of highlighted, the information coming out of the research is very clear, and those extra kind of precautions are definitely being taken. If you're being asked to come in, it's because of, kind of keeping you and your baby safe.
Brilliant. Now, I remember at the start of the pandemic, partners weren't allowed to attend appointments and were kind of they were called into labour when it was birth was almost imminent. Is that still the case?
It's changing. As we come out of another lockdown, it will change again. So at the beginning, there was a very kind of clear, when we didn't have access to as much PPE and testing, etc., there was kind of a very kind of clear shutting down on partners only being able to attend when you were in active labour. So partners have always been able to attend, be there for the birth of their baby, and that's because we know having a birth partner there is really, really important. It's essential to well-being of mum and to baby. It's essential in, kind of emotional as well as kind of physical needs as well. But as you say, sometimes that was kind of turning out to being that by the time people were able to kind of get into the hospital, baby was almost being born, etc. And that was kind of, difficult for a lot of people. As we came out of that kind of first wave, different hospitals in different areas, as we kind of remember that time when we were in a tier system somewhere, it feels like a long time ago, but when we were in that, different hospitals are kind of working in that way. But over the last, I know definitely, kind of hospitals around where I am in London have, even in this lockdown, partners have been able to attend scans, so 12-week scans, 20-week scans, and have been able to kind of be there from the beginning of labour. So if somebody was being induced, for example, their partner has been able to be there. It does vary from hospital to hospital. Sometimes it's a logistical thing, hospitals vary in size. So, if you've got the really old hospitals where social distancing is going to be really hard, it's probably a little bit harder than a, kind of a newly built, purpose-built hospital where that can kind of be put into place. And kind of obviously at one point what kind of the infection rate in the local area was. What I would like to kind of highlight is that if, people if that's what's putting you off from attending your appointments, have a conversation with your midwife. We have always had the flexibility of kind of being able to, kind of let partners in so that they can support in circumstances where it's important. So if people have experienced loss.
Thank you so much for that, Amina. That is actually all we have time for, but didn't want to interrupt you because you were doing so well. Now, the situation with COVID-19, with the advice given, is always changing. So please ask your midwife for further advice. We will be back after this break with more, so do please come back. See you soon. Assalamu alaikum everyone, and welcome back to The Health Show. My name is Sulthana Ahmed and I'm your host. Now, if you missed the first half, you can rewatch it on British Muslim TV's Facebook, YouTube or Twitter pages, so please check it out. There was lots of useful information there about being pregnant during COVID. Now, moving on, this next segment is about improving your general health. Now, I don't know about you, but I know in my experience as a GP, with lots of the conversations I've been having, many patients have said to me, doctor, during the pandemic, I have started to eat more junk food than I would usually. I have gained a few pounds. I was exercising to start with, but during the winter months, that kind of tapered down as well. Some patients, unfortunately, have restarted smoking. And for those who drink, they have also started drinking more than they would usually do. Now, all of this obviously will impact on your general health. And the interesting thing about the COVID pandemic is we are at a unique moment in history where lots of people are actually thinking about their health. They are taking notice of their health more seriously and realizing that poor health can have unforeseen implications on the quality of your lifestyle, such as it did in COVID-19. Lots of my patients who were obese or overweight, had quite frank conversations with me about how they didn't realize the true impact it can have on their health. So, following on from that, at the start of 2021, it was noted by myself, and it's backed up by research, that many people are actively thinking about their health, taking it a bit more seriously. So we know that 7 in 10 adults are motivated to get healthier this year. Now, what does healthier actually mean? Now, you might be surprised or shocked to know that actually for different groups of people, there are different ranges of what is considered a healthy BMI, what is considered a healthy blood pressure, and things like that. So I'm not going to go into detail about those specific parameters on today's show. I will redirect you to go on and have a look at the NHS website. On my social media page, I have also discussed how for South Asian people, actually a lower BMI is preferred. So, for example, very briefly, for the general population, we ask you to aim for a BMI between 18.5 to 25. That's considered the normal range. And it is actually lower for patients who are Black or South Asian or from other ethnic minorities. Their target is actually 16.5 to 23. Now, you might think, well, what do these values actually mean? I have no idea what BMI is and what those numbers are. I don't know what I am. So again, you can go on to the NHS website and they have a BMI calculator. Feel free to Google that if you need. It basically asks you for your age, weight, height, and they will calculate your BMI for you. It also asks you for your ethnicity. And if you put in that you are Black or South Asian, then it will give you a lower range of BMI. Now, Public Health England have realised that more people are thinking about their health and are serious about their health, and they are wanting to help you with that. So discuss more about that campaign. I have with me a GP from down South London. His name is Dr. Mohammad Khaki, who will discuss this with me in detail. Assalamu alaikum and welcome to the show.
Salam wa rahmatullah. Thank you so much for having me. Lovely to meet in this forum.
I know, I thought I recognized your name. So for those of you who don't know, Dr. Mohammad Khaki and I are both on social media. So we are on Instagram friends, and you appear on TV all the time. So it's so good to have you on British Muslim TV today.
Yeah.
So how are you doing this evening? Please tell us about yourself and what you do.
Well, as you know, I'm a GP and I'm doing well. It's a lovely day, and I hope we're on the way to getting over this corona hump, and vaccinations are on the rise. As you know, I'm a GP and also discuss health topics, and like yourself, we're looking to work together to see how we can improve the understanding of health and interaction with health services. And that's why I'm really glad to be part of this Better Health campaign.
So so for our viewers who may not know, are you able to tell us more about this campaign?
Yeah, absolutely. I mean, the Better Health campaign is a major health campaign, and it's designed really to encourage us to support adults across the whole country to become more active and make healthier food choices, really to reduce their weight.
Excellent. And like you said, it is a national campaign. How relevant is the advice from the campaign for pockets of community, for example, like the South Asian community or the Black community? Do you think it's relevant to everyone?
Well, essentially, you know, what we found is that a lot of us want to change our health. And Public Health England are particularly working with South Asian healthcare professionals and experts to target this population, because we know that the South Asian adults tend to have more of a chance of getting chronic health diseases, but actually from COVID-19 have said that they really want to engage more with health services and actually improve their health, especially their physical health. And so now it's about making that information available to help us with making our lifestyles healthier.
Excellent. So that is really good to know, and that campaign is definitely needed, especially after all of the health disparities and inequalities that COVID-19 has highlighted. Just out of interest, are you able to suggest some healthy food tips for meals?
Yeah, absolutely. I mean, one of the things that we talk about with healthy meals, there's a couple of things that we can suggest, and there's a lot of hints and tips. I will try to be specific to sort of the Asian population, because I think that's really helpful for us.
Yeah, thank you.
There's a couple of things that we do that we can improve on. So one of them is being portion aware. So what that means is looking at how much we put on our plate or bowl, or using smaller ones, which show people that there's a lot of evidence that shows that smaller bowls mean we eat less. And of course, trying to not have second helpings where possible. There are small changes we can also make to our diet. So for example, swapping out our white rice for brown rice, or using more wholemeal things. These are really helpful things that can benefit us by improving our fiber and reducing what we call our simple carbohydrates. Then, of course, there's healthier snacks. So maybe a handful of roasted chana, or whole almonds, or peanuts that are unsalted, or wholemeal bread. That's maybe we have a couple of spoonfuls of hummus. Now, these are quite healthy snacks. They're wholesome, but they keep us full for longer. And of course, the other thing that helps to keep us full for longer are things like fruit and vegetables. Not only are vegetables great for making us feel full and not so hungry, they also have low calories. So we can eat a bit more of those and not put on that weight. And the final thing that really, I think, for our population is really important is looking at the amount of juice we drink, because we love our juice, and even unsweetened fruit juice, which is an incredible statistic, can have so much sugar. So try to stick to maybe about 100 to 150 mils, maybe a small glass a day, and you won't end up drinking a lot more sugar than you realize.
So there are actually some really useful tips there. And I know what you commented on about the fruit juice is so true. Like, many patients don't realize the amount of sugar that is in those drinks. Just very quickly, are there any other examples of how people can keep fit during lockdown, or as we are still in kind of social distancing measures?
Yeah, I mean, there's some really easy things we can do that we sometimes take for granted. I always think about our day and think about our time, and I appreciate everyone has got a really busy schedule, but we're looking at maybe 20 to 30 minutes of movement. And by movement, something like even a brisk walk around the block can really help to boost our energy, give us a boost of our mood, and also help the blood pump around and help us to towards our wellness journey. And whilst we were previously now in a lockdown, now today and yesterday have been the first few days we've been lifted from that. It's now important for us to try and get some of the outdoor exercise. You know, getting out and about, walking around, and getting some fresh air is really helpful. And of course, we know that nature and looking at nature also has a really good effect on our mood as well, which a lot of us, you know, have been suffering with, especially being cooped up in the house for so long. I think one of the things that people do when they're trying to get fit, that we see a lot of, and is a really helpful tool to look out for, is trying to start by doing too much. So I'm going to cut all the things I love from my diet, and I'm going to exercise 3 times a day, and I'm going to get really fit. It's really great to be ambitious, but I think it's important for us to start slowly. And one of the best things that we've got from the Better Health campaign is a free app called Active 10. And Active 10, what it does is it helps you to track and build up your daily walks, starting from just 10 minutes a day, which all of us can squeeze in at some point. Of course, I think it's important to tailor what we're doing to things we enjoy. So it could be that you like spending time with a friend, or you like seeing your partner or something, and you want to use that time to do something fun. So maybe using that as a time to walk, or perhaps you want to get fitter, like really fit, and run a 5K. So there's a really cool app we've got called Couch to 5K. And I think you may have seen it, and you know, we talk about it to our patients. Yeah. If this app is something you want to do, if it's something you really have aspired to, seeing a lot of people doing 5Ks, well, if you're sitting on the couch right now watching this, thinking, I want to do this, this app will walk you through it all the way up to 5K. And everyone who I've recommended this to has been really successful with it. So I think those are sort of really good tips. Of course, if the weather isn't like today and you feel that you want to exercise but you want to do something at home, of course, I think it's about looking at our surroundings and using that time. So the NHS Better Health website, so it's nhs.uk/Better Health/Get Active, tells you how to do your activity at home, and that's a really good place as well.
Thank you so much for that, Dr. Khaki. Unfortunately, that is all we have time for today, but you literally jam-packed that session with absolutely brilliant advice. So hopefully many of you sat at home will have found that useful. There is so much more information available on the NHS website. Like Dr. Khaki has said, please do have a look at that. And there are also lots of apps that you will find listed on that website that you can help. Now, unfortunately, that is the end of today's show. Please do tune in next week for some more health advice. My name is Dr. Ahmed, and it has been a pleasure hosting you today. Take care and have a good evening tonight. Bye now.